Well, I'm so glad that my brain is lightning fast and I can process all of these things instantly. Having a cold even revved it up further. So let me begin by just making some general summary comments about both of these presentations and then make a few personal comments about how they have connected with my own uh, perspective and what I bring to the table. Uh, both of these presentations highlighted the need for clear and concise communication with the public. Um, uh, uh, Dr. Hickey's presentation talked about how the healthcare worker must adapt their methods for communication according to the needs of the patient, and that the members of the healthcare team or the PMI organization could very well serve as a sort of interpreter or a translator for the difficult concepts and jargon. And the critical questions we need to be asking is that you said it explicitly. What does this new information mean to the patient? And you said it implicitly because we saw what happened when people didn't ask that question. But in addition, we need to ask, what does this new information mean for the clinician? And in both cases, we need to support the development of competencies, both in training and in resources or tools for the healthcare professionals, but also for the public. And both are needed to support. It's that two-sided coin of health literacy. It's how well does the health system, the researchers interface with the public, and what skills and capacity does the public have to interface with the health system. And these must be addressed. If we have learned anything over the last 10 years with regard to health literacy, it is that people in the healthcare system often have wrong ideas about how much people understand. And where people need to start with their understanding is different from where people in the health system think they need to start. And we need to get a clue that people need to start at a different point than what we often are ready to start at. And so this means to me that the people who are involved in this initiative need to care, and they need to care deeply about whether people understand what they're trying to do and to take appropriate action to confirm understanding. And if we do not do this, then we run the risk of never establishing the very fundamental foundation that Mike Wolf talked about in the beginning of today's lectures, and that the fundamental foundation for all of this in precision medicine is trust and understanding. And if we are not thoughtful in terms of how we communicate with the public, we'll never get there. We must help the public understand, and we must treat the public with respect. Otherwise, we will never have the trust that we need. And if there is no trust there, then you can just go look on social media and see what that does. So I'm going to stop my comments here and pass them on.
So first